All right, good morning. All right, so this is Nurse Eunice with Florida Training Academy, and we are going to be reviewing 25 practice CNA questions on how to handle medical emergencies. And so, if this is your first time tuning in, please put your name and your city or your country in the chat, and welcome to Florida Training Academy. I'm going to start. My name is Nurse Eunice, and I am in Jacksonville, Florida. All right, so let us begin. All right, so question number one. What is the first step a nursing assistant should take when encountering a medical emergency at a client's home? Should she A, assess the situation, B, call 911 or the designated emergency number, C, administer first aid, or D, notify the charge nurse? You're in a client's home and there is a medical emergency. What should you do? All right, if you chose B, call 911 or the designated emergency number, you're absolutely correct. For the United States, we call 911, but for other countries, there could be another emergency number. So the rationale, the priority in any medical emergency is to ensure professional medical help is on its way. Calling 911 or the designated emergency number should be the initial action to take. So when you're in a home care environment, make sure you call 911, and then once the person is stable, you can notify the nurse. Question two, which of the following vital signs is most crucial to assess for a patient with a diagnosis of sleep apnea? Is it A, temperature, B, blood pressure, C, heart rate, or D, respiratory rate? And if you're just tuning in, go ahead and, write in the chat your name, your city, your country, so I know who is online with me. And let's see, a patient has sleep apnea. Which vital sign is the most important for that diagnosis? And if you chose D, respiratory rate, you're absolutely correct. Yes, that is correct. So, rationale, the respiratory rate is vital as it indicates the patient's ability to breathe, which is essential for sustaining life. Any compromise in breathing requires immediate attention. With sleep apnea, your person or your patient can stop breathing for periods of time. It could be a few seconds, but the breathing could be abnormal and it can also be snoring. So, in that case, whenever you have someone who, when you're monitoring a respiratory rate, you should be counting for 1 full minute. Don't do 15 seconds and then multiply the number that you received by four. Count for 1 full minute, especially if it's irregular, so that we can have the appropriate or the correct respiratory rate. And remember that the normal range for an adult respiratory rate is between 12 to 20 breaths per minute. Question three, during CPR, what is the recommended compression to breath ratio for adults? Is it A, 10 compressions to one breath, B, 15 compressions to two breaths, C, 30 compressions to two breaths, or D, 50 compressions to two breaths? Hi, Aretha from Oakland Park, Florida. I went to school at FAU, so I went to school down in Boca. So nice to meet you online. All right, so what is the correct compression to breath ratio? Revealing the answer in three, two, and here it is, everybody. So the correct answer, whenever you're administering CPR to an adult or a child and you're a single rescuer, it's going to be 30 compressions followed by two breaths. And that's the American Heart Association's recommended compression to breath ratio. So for this one, they were speaking specifically about adults, but remember that if a child has reached puberty, we treat them as an adult also. Hi, Letitia from Houston. Question four, if a patient is choking but is still able to cough forcefully, what action should the nurse assistant take? Is it A, perform the Heimlich maneuver, B, encourage the patient to continue coughing, C, administer back blows, or D, give abdominal thrust? And we'll reveal the answer in 5 seconds. All right, let's see. The person is still able to cough forcefully. We have one answer, And you all, the answer is B as in boy. Whenever a patient is able to cough, they don't have a complete obstruction. You want to encourage them to cough, and hopefully that will move or dislodge the obstruction. Whenever they are unable to cough any longer, if it's an adult, usually they know the universal choking sign is when they put their hands up to their throat, and that is when you would do the abdominal thrust, formerly referred to as the Heimlich maneuver. But if they're coughing, encourage them to cough. Question 5. When assessing a patient's level of consciousness, which of the following is a correct response to verbal stimulation? A, opens eyes to bright light. B, open eyes to voice. C, open eyes to pain. Or D, does not open eyes. Verbal stimulation. Hi, Jerlene and Tisha. Good luck on your test in a few weeks. Verbal stimulation. All right, revealing the answer in 3, 2, and 1. Almost, Latifa. I don't want to mispronounce your name, so I'm going to call you Mrs. Ibrahim. All right, so the correct answer is going to be B. When someone responds to verbal stimuli, they will open their eyes to voice or to sounds. All right, so the rationale, opening eyes to the loud voice, or it could be, you're just coming in and greeting a resident and they open their eyes, indicates a response to external stimuli and suggests a level of consciousness. So if you have a person who was previously responsive to voice or to sound, and now they are not responding, that would be a medical emergency. It could be that they're asleep, but then you can start touching them, as far as like their shoulders or their arms, trying to stimulate them. But anytime there's a change in condition or change in consciousness, you want to make sure you notify the nurse. Question 6, what is the appropriate position for a patient experiencing shock? Is it A, supine? Supine means flat with the legs elevated. Is it B, lying flat on the stomach? Is it C, sitting upright with the legs dangling? Or D, semi-Fowler's position? That's a reclining position. So when someone is in shock, usually their pressures are low. What is the best position if someone has low blood pressure? Revealing the answer in 3, 2, and the correct answer is A. Great job, everybody. Supine with the legs elevated. So when you look at the image there, elevating the legs helps to improve the blood flow to vital organs and can assist in managing shock. So this isn't something that a CNA would do without a nurse being present. You've called the nurse into the room because maybe the patient was dizzy. We're going to have you do the vital signs, and then the nurse will probably ask for you to elevate the resident's legs if they're in a traditional bed. Sometimes we have you put them upside down in what we call a Trendelenburg position, and what that does is it brings the blood from the legs towards the vital organs like the heart and the brain, and that will help temporarily to reduce some of the patient's symptoms such as dizziness. Question number 7, which of the following symptoms is a characteristic of hypoglycemia? Hypo, that prefix means low. Glycemia is the levels of blood sugar within the bloodstream. So hypoglycemia, low blood sugar. Which of the following is a symptom? Which of the following symptoms is characteristic of low blood sugars? Is it A, increased thirst, B, warm, flushed skin, C, rapid, shallow breathing, or D, confusion and irritability? How do you feel when your sugars get low? When you haven't eaten all day? Revealing the answer in 3, 2, and 1. It's going to be D, everybody. It's going to be confusion and irritability. Those are common symptoms of low blood sugar levels, and you want to notify your nurse. Once you're on the floor, they'll teach you how to use the glucometers or the finger stick, the blood sugar machines that we have at the bedside, and that's how you would actually help to check your patient's blood sugar levels. And you normally give them, if they can still speak, if they're still coherent, you give them about 4 ounces of orange juice. But again, your nurse would notify you when to give orange juice. If the person's sugars are so low that they're unable to speak, the nurse will usually start a IV and give dextrose intravenously. All right, question number 8. What is the recommended action if a patient is experiencing a seizure? Is it A, restrain the patient to prevent injury? Is it B, place a spoon in the patient's mouth to prevent them from biting their tongue? C, move nearby objects away to prevent injury? Or D, administer a sedative medication? Well, we know it's not D because CNAs don't administer medications. So, which of the answers is it A, B, or C? Yes, Jerling, you are correct. Yes, Tish, the answer is C. So when someone is having a seizure, their body may start moving. It could be thrashing on the floor, or they could be thrashing in their bed. So you want to move nearby objects away to prevent injury. And here's the rationale again. During a seizure, the priority is to ensure the patient's safety by removing nearby objects that could cause harm. We do not hold them down. If you're in a public location and maybe there aren't pillows nearby, but their head is hitting the ground, you can put a purse, a coat, just something to cushion their head, but don't hold them. And as you see in this photo, after the seizure is completed, we usually put them on their side in the recovery position. If you're working in a hospital or a nursing home, we'll ask that the CNAs pad the rails. And we can't take the rails down, but we can put padding against them to make it softer. So if the patient does have a seizure while they're in bed, there will be less chances of injury. Question 9. Which of the following is a sign of a possible stroke? Is it A, nausea and vomiting, B, slurred speech, C, increased blood pressure, or D, rapid heart rate? Possible signs of a stroke. Revealing the answer in 3, 2, you have the right answer. Very good. It is B, slurred speech. All right, so slurred speech is a common symptom of stroke, indicating potential neurologic impairment. And even though it may be hard for you to see the dice there, anytime that you think someone's having a stroke, we want you to think fast. F, you want to look at their face. Usually it's going to be drooping on one side. A, if you ask them to raise their arms, both arms won't be able to raise to the same height. One arm is going to be weaker than the other. Speech would be the S. Ask them to say their name, and their speech may be garbled. And then T, time to call 911 if you're in home care. If you're inside of the hospital, it's time for you to call a code. You're going to press that emergency panic button. So anytime you think stroke, think fast. Face, arm, speech, and time. All right, so question number 10. What is the appropriate response if a patient experiences a sudden loss of consciousness while walking to the bathroom? A sudden loss of consciousness while walking to the bathroom. Do you A, place the patient in a seated position? B, elevate the legs above the head? C, lower the patient to the ground? Or D, apply a cold compress to the forehead? You're walking someone who is losing consciousness. What do you do? Yes, you're absolutely correct. The correct answer is C. You're going to lower the patient to the ground. Of course, you're screaming for help while you're doing so, but that second part wasn't given. But you're going to lower the resident to the ground. Lowering the patient to the ground helps to prevent injury due to falls and ensures an open airway for assessment and intervention. And you're going to keep the person on the floor until the nursing team and the other staff come and assist. And from that point forward, that patient is officially on fall precautions, and they'll usually have a yellow wristband that says fall risk. Okay, so they would not be able to walk to the restroom without assistance, and it's probably best for them to have a bedside commode because they'd be unsafe to walk to the bathroom. Question 11. What should a nursing assistant do if they suspect a patient is experiencing a heart attack? A, administer aspirin. B, encourage the patient to rest. C, monitor the patient's vital signs. or D, activate emergency medical services. Your patients complain of severe chest pain. What do you do? Revealing the answer in three, two, and one. The answer is D. And I know the term emergency medical services is not something you commonly hear, but it just depends on where you work. Again, if you're in home care, that's calling 911. If you're in the hospital, we don't get to call 911. We are 911, but you do have to press the code button to get assistance. So timely intervention is crucial in suspected heart attacks. So activating the emergency medical services is priority. And again, what I just stated, if you work in a facility, you would press the emergency alert or code button. If you work in home care, you would call 911. All right. And if this is your first time joining us and you haven't subscribed yet, go ahead and subscribe to our channel. My name is Nurse Eunice. I've been a nurse now for 25 years, and I love helping people pass their exams, whether it's the CNA exam, the nursing exam, the CPR exam, instructor courses, just a wealth of knowledge. And I love being your instructor. So go ahead and join us. All right. Question number 12. What is the primary goal of cardiopulmonary resuscitation, also referred to as CPR? Is it A, restore normal heart rate or rhythms? Is it B, improve oxygenation? Is it C, maintain blood pressure? Or is it D, sustain blood circulation and oxygenation? So when you're compressing on that chest, when you're going 2 inches, what are you trying to achieve? And I see a couple answers, and the answers I see are correct. Correct answer is D, everybody. You want to sustain blood circulation and oxygenation. So when someone goes into cardiac arrest, when the heart stops, the oxygen that's in the bloodstream doesn't leave, it doesn't evaporate, it's just not circulating. So whenever you start doing high quality chest compression, beginning with CPR, beginning with chest compressions, you're actually compressing on the heart, which is circulating the blood to the vital organs. And so that's how you're helping to sustain life until the paramedics get there, until your code team gets there. And when we use the AED, the defibrillator, the shocking device, that is what helps to restore the heart into a normal rhythm. But just your compressions circulate blood to vital organs. So great job, team. All right, question 13. Which of the following is a common symptom of an allergic reaction? Is it A, hypothermia, B, bradycardia, C, itching and hives, or D, hypertension? Common symptom of an allergic reaction. So hypo in front of a word means low. Thermia is temperature. Yes, Vernette. Yes, Julie. You all are correct. The answer is C. And if you're not familiar with some of these terms, we have 2 medical terminology videos that will help you learn additional medical terms. So the answer is C, as we already stated. Itching and hives. So when you look at this baby's face, that is a sign of an allergic reaction. So itching and hives are common manifestations of allergic reaction, often due to the release of histamine. And some of the common allergens could be bee stings. It could have been sometimes the detergents that we use could be strong and irritating to our skin. It could have been something we ate, such as peanuts or shellfish. So if you see anything abnormal on your patients, please report it to your nurse. And also medications. Sometimes we give patients medications that they never had before, and we find out afterwards that they're allergic to the medication. Question 14. What action should be taken if a patient is experiencing severe bleeding? A, apply direct pressure to the wound. B, elevate the affected limb. C, remove any embedded objects from the wound. Or C, clean the wound with alcohol. Ouch. We automatically know it's not D. Yes, Burnett, you are correct. It is A as in apple. Severe bleeding, put some gloves on and apply direct pressure to the wound. So applying direct pressure helps to control bleeding by promoting clot formation and reducing blood flow. And you can also elevate the extremity above the heart. So apply direct pressure and elevate the extremity if possible. All right, 15. I kind of hinted and gave you this answer before. But what is the purpose of the recovery position? Is it A, to maintain an open airway, B, to prevent hypothermia, C, to reduce blood pressure, or D, to improve circulation to the extremities? The recovery position. And Joanne, you have it. So, whenever you put someone in a recovery position after a medical emergency, it is to help keep their airway open because they may vomit. So we don't want to keep them on their back. In the image, we have the male. He's using. We have his arm supporting his head. And if you're the rescuer, if you're the only one there, you always want to be monitoring them to make sure they're still breathing. Because if they stop breathing, you'd have to lay them on their back and start CPR. So recovery position helps to prevent airway obstruction by keeping the airway clear and allowing fluids to drain from the mouth. And this is what you'll do after a medical emergency, such as a seizure. Question 16. Which of the following is a symptom of diabetic ketoacidosis? We call that DKA. And so, with your diabetic patients, they can have hypoglycemia, they can have hyperglycemia. So, when those sugars get really high, they're going to start exhibiting some symptoms. So, is it going to be A, hypoglycemia, B, fruity breath odor, C, bradypnea, or D, low blood pressure? And I'll help you with those terms. We know it's not A because I kind of told you DKA is when the blood sugars are high. Yes, it is B. It is telltale sign. You go in and your patient's breath smells fruity and they're not chewing bubble gum or eating any fruit, then more than likely their blood sugars are high. And if you look at their diagnosis, that's probably the reason why they're in your hospital or your nursing home to begin with, due to elevated blood sugars. So the fruity breath odor is a characteristic sign of DKA, indicating the presence of ketones in the breath. Great job, team. We have a few more questions left. Question 17. What should a nursing assistant do if a patient exhibits signs of respiratory distress? A, administer oxygen immediately. B, encourage the patient to lay flat on their back. C, offer a glass of water to drink. Or D, place the patient in a high Fowler's position. Respiratory distress. Your patient's having a hard time breathing. What position do you want them in? You had to rethink it, Tish. Vernette, it's not A because CNAs can't administer oxygen. Oxygen's a drug. Yes, it is D. It is D. So, what a CNA can do is if the oxygen disconnects or the tubing disconnects from the flow meter, you can reconnect the tubing. But at no point should you just start oxygen. That would be a nursing or a respiratory therapist duty. So, the correct answer for this one is going to be D as in dog. All right, and so we're going to place the person in the high Fowler position. The high Fowler position, or sitting them up close to 90 degrees, is also used for individuals with breathing difficulties as it pulls down the diaphragm and relaxes the abdominal respiratory muscles, thus allowing maximal chest expansion and improvement of symptoms. So in this image, this kid appears to be in the home care setting, and he has this nebulizer treatment, but he's sitting upright in a high Fowler's position. So, of course, alert your nurse and then change their position. And the nurse will give you further instructions whenever he or she arrives. All right, question 18. What is the recommended action for managing a nosebleed? Is it A, tilt the head back? B, apply pressure to the nostrils? C, insert cotton swabs into the nostrils? Or D, administer nasal spray? This one's easy. I know you all know this one. Vernette, that's old school. We don't do A anymore, everybody. We don't tilt the head back. You end up swallowing the blood. Give me another action, another answer. It is B. So this is what we do, everybody. You apply pressure to the nostrils, but you hold your head forward. And if there is any blood that's escaping, you spit it out your mouth. Whenever you squeeze the nostrils and hold the head back, it guarantees that you're going to have blood running through the back of your throat and you're going to end up swallowing the blood. So this is the best option. Question 19. Which of the following is a sign of shock? And we already covered this one, so this should be easy. A, hypertension. B, rapid pulse. C, warm, dry skin. D, increased urine output. So when someone has shock, when they're in shock, their blood pressure is low. So it's not a hypertension, it would be hypotension. And their heart is trying its best to compensate, to pump, to pump, to pump, to pump. And that's your hint. So what's going to be the answer? Heart's trying to compensate. If they had a heart monitor on, you're going to start seeing a spike in their heart rate. So the answer is going to be B. That is correct. So um, the normal range for an adult heart rate or pulse is 60 to 100. So usually if it's greater than 100, we call that tachycardia. So a rapid pulse, which you'll be feeling the radial pulse, or you'll be looking at the heart monitor, is a common sign of shock, indicating the body's attempt to compensate for decreased blood flow. So we'll see the blood pressure starts to lower, but that heart rate start to go up. Again, if that happens, you're sometimes the first one in the room with the patients. You spend the most time with the patients. You're going to notice these changes. Make sure you let your nurse know. All right, team, question 20. What is the appropriate action if a patient is experiencing a minor allergic reaction without difficulty breathing? Do you A, offer a glass of water? B, administer antihistamine such as Benadryl? C, use an EpiPen auto injector or EpiPen? Or D, notify the nurse? And remember, you have to know your role as a CNA. You don't give medicines. You don't give medicines. So, yes, it's going to be D. It is going to be D as in dog. Great job, everybody. So, for your CNA test, you cannot administer medications. Even if you take a medication administration course that some of the nursing homes take, for your CNA exam, you do not administer medications. So, instead, you do D, you notify the nurse because an allergic reaction can worsen and become life threatening. You want to notify the nurse so that medications and additional treatments can be provided. 21. What is the purpose of the Glasgow Coma Scale? We also call that GCS. Is it A, assess motor function, B, measure blood pressure, C, evaluate consciousness level, or D, determine oxygen saturation? Your patient's in a coma. What do we want to be monitoring for? Yes, Kripa. Great job. Yes, it is C. So whenever we're using the Glasgow Coma Scale, it's used to assess the quality or the level of consciousness in patients with brain injury or altered mental status. And there is a sheet, a little checklist that you fill out more than likely about every hour, plus your nurse will be filling out one also. And that's going to let us know if the person is deteriorating or improving. Question 22. Which of the following actions should be taken if a patient is having a seizure? A, restrain the patient's movements. B, insert a padded tongue depressor into the mouth. C, move nearby objects away to prevent injury. Or D, administer oral medication. And we already answered this one, so that's a freebie. All right, and you are correct. It is C, move the nearby objects away. That one was too easy. Let's go to 23. What should a nursing assistant do if a patient's airway is obstructed by a foreign object? Do we A, administer abdominal thrust, previously referred to as the Heimlich maneuver? Do we B, insert a finger into the mouth to remove the object? C, encourage the patient to cough forcefully? Or D, administer chest compressions? And don't get tricked. This person's airway is obstructed. So they're not coughing at this point. What do you do if the airway is obstructed? Nope, nope, nope. It is Hey, this one was tricky. If the person's coughing, you encourage them to cough. But when the airway is totally obstructed, you're going to have to do the abdominal thrust. You're going to have to perform the Heimlich maneuver. And the image here is an example of how you do so. You do those abdominal thrusts going in and up until the object is expelled, until the person tells you to stop. Or if the person becomes unresponsive, you lay them on the ground and start CPR. If you're by yourself, you have to use your cell phone to call 911 or go to get some help immediately. If you're in a facility, you would scream out for others to come and assist you. Question 24. Which of the following is a symptom of heat stroke? Is it A, shivering, B, cool, clammy skin, C, rapid pulse, or D, pale complexion? So a heat stroke is a medical emergency. This person's so hot until they're not even sweating at this point. What do you think a symptom would be? Something that you would be able to detect? I'm revealing the answer in 3, 2, and was close. It's the rapid pulse. So, a rapid pulse is a common symptom of heat stroke, reflecting the body's attempt to cool down. And so, whenever you think about heat exhaustion, think of someone who's really hot, a construction worker, but they're still able to talk to you and they're still able to drink fluids. Heat stroke, this person is pretty much incoherent or they are unconscious. And so this visual aid here kind of tells you the difference. So heat exhaustion, they could feel faint or dizzy. They may have excessive sweating, which is body's attempt to cool itself down. They could be cool, pale, clammy. They may feel nauseous. They too would have a rapid, weak pulse. And they can also start, saying that their muscles are cramping. That's when you give them some room temperature water, you give them some electrolyte beverage, and they should start perking up shortly once they're rehydrated and they take the rest of the day off. Versus heat stroke. Heat stroke, throbbing headache, no sweating. The body temperature raises above 103 degrees Fahrenheit. They may become nauseated. They have a rapid, strong pulse, but they may lose consciousness. So you're not going to put anything in their mouth. You're going to cool them off with maybe some fans, or you can just, fan manually with your hand or a book. Take off any necessary clothing. You can put ice in strategic locations like the armpits, but you have to call 911 if someone's experiencing a heat stroke. 25. What is the appropriate action if a patient's wound is actively bleeding? A, apply a tourniquet proximal to the wound. B, remove any foreign objects from the wound. C, elevate the affected limb above the heart. Or D, apply direct pressure to the wound. And this one should be easy. The wound is actively bleeding. And there's the answer, everybody. Great job. We're going to apply direct pressure to the wound. Remember, applying direct pressure helps control bleeding and promotes clot formation. And so I do have a second managing medical emergencies. I do have a second test, but sometimes you all like some of my other questions more than the ones on medical emergencies. So if you want more questions like this, because at the end of the day, you all are in the room with these patients and the nurses, especially if you're in the nursing home, you may only have one patient. So if there's a medical emergency, one nurse, if there's a medical emergency, you have to know what needs to be done until the nurse gets there. So I think this is important because it helps you be a critical thinker as a CNA. But let me know if you want more of these type of questions, or if not, let me know what topic that you want me to cover the next video. Again, this is Nurse Eunice with Florida Training Academy, and our website is fltraining.com. And I will be back on here again on Monday with more practice questions. So everybody have a wonderful Easter and a good night. Bye-bye.